Hey, listener. Ready for another deep dive?
Absolutely.
Today, we're tackling something I think we all worry about: head injuries.
Yeah, it's one of those things, right?
Better safe than sorry, as they say. But, what's actually going on in our brains when they get, well, bumped?
It's a question that's puzzled doctors for centuries. And the more we learn, the more we realize that even little bumps can have a big impact.
Okay, so let's say you're at the scene of an accident and someone's down. Maybe they hit their head.
First things first, you got to act fast, but stay calm, right?
Right.
Those first few minutes,
Yeah.
they're crucial. We call this the primary survey. Basically, you're checking for anything life-threatening: airway, breathing, and circulation. You're buying time until the professionals get there.
So the ABCs. Got it. Making sure they're breathing, no major bleeding. But what about the stuff we can't see? Those hidden signs of a head injury.
That's where the Glasgow Coma Scale comes in.
Yeah.
GCS for short. Now, I know it sounds complicated, but
A little bit, yeah.
it's actually pretty straightforward.
Okay.
Even without any medical training, you can use it to assess someone's consciousness.
How so?
You're basically checking three things. Can they open their eyes? What's their verbal response like? And how are they moving?
Makes sense.
A low score on this scale. Big red flag. Even a single-point drop on the GCS can mean a way higher risk of long-term problems.
Wow, I had no idea it was that sensitive. So low score equals bad news. Anything else we should be looking at?
The pupils.
Their eyes.
Yep. They should be the same size and react to light. If one's bigger than the other or not reacting right, that could be increased intracranial pressure.
Okay, hold on. Intracranial pressure. That sounds serious.
It is. Think of your brain like a balloon
Okay.
and your skull's like a helmet. Now imagine blowing more and more air into that balloon. What happens?
It's going to put pressure on the helmet.
Exactly. That's intracranial pressure, or ICP. Too much pressure, and it starts squeezing the brain.
That can't be good.
Not at all. It can cause some serious damage.
So what happens if someone has crazy high ICP? How can you tell?
There's something called Cushing's triad. High blood pressure, a heart rate that's slowing down, and their breathing gets all irregular.
That's a lot going wrong at once.
It's basically a distress signal from the brain.
Yeah.
And if it goes on too long, there's a risk of herniation.
Wait, herniation? Like a slipped disc in your back?
It's not exactly the same, but kinda.
Yeah.
Imagine the brain being pushed so hard against the skull it starts to push through any opening it can find.
Okay, yeah, that's definitely not good. Makes you realize how fragile the brain really is. But you mentioned other types of brain injuries, not just this pressure buildup.
Absolutely, and those are important to understand too.
So we've been talking about ICP, all that pressure inside the skull,
Right.
but you mentioned there are other ways the brain can be injured, even without that extreme pressure.
Exactly. We've got to remember the brain itself can be directly injured. One of the most common we see is a subdural hematoma.
Hematoma, that's a blood clot, right?
You got it. A subdural hematoma is a blood clot that forms between the brain and the skull. And here's the thing, they can happen slowly, even after a seemingly mild injury.
See, this is what gets me. I think a lot of people assume if you don't get knocked unconscious, you're probably fine.
Right, and that's not always true.
But what you're describing is you could feel okay initially and then...
Things can take a turn, definitely.
Wow.
That's why we always talk about those delayed symptoms. Just because someone seems fine right after a bump doesn't mean we can let our guard down. Another type of hematoma we see is an epidural hematoma. It's a little different.
How so?
Well, this type of blood clot forms between the skull and the dura mater,
The duramater.
the outer layer of the brain. And epidural hematomas, these can develop really fast.
So with a subdural hematoma, it might be a slow bleed. But epidural, we're talking.
Yeah, much faster.
Yeah.
Someone with an epidural hematoma might lose consciousness, wake up for a bit, and then deteriorate really quickly.
Oh, wow. So much faster and that much more dangerous.
It's a true emergency.
Okay, so different types of bleeds, different speeds, different levels of danger. But you also mentioned other types of brain injuries, not just these hematomas, right?
You bet. There's another one called diffuse axonal injury, or DAI for short. And it's different from the hematomas we've been talking about.
Okay. In what way?
Well, it's not so much about the bleeding, but more about damage to the actual nerve fibers in the brain, like shearing or tearing of the axon.
Shearing, like if you twist your ankle really badly.
Yeah, kind of like that, but happening inside the brain.
Ouch.
And unfortunately, DAI is really common in those high-impact situations like car accidents or really bad falls.
Makes sense. All that force being transferred to the brain.
And to make matters worse, DAI is often more severe in folks who are on blood thinners. because they're more likely to bleed inside the brain.
Right, so more bleeding on top of the shearing.
Exactly.
Okay, so let's say someone suspects a head injury, maybe after a fall or something. What happens next? How do doctors even begin to figure out what's going on inside the brain? So we've talked about all these different types of injuries: subdural hematoma, epidural hematoma, diffuse axonal injury. It's a lot. And honestly, kind of scary.
You're right. Head injuries are nothing to mess with. But the good news is we've got ways to figure out what's going on.
So let's say someone's worried, maybe they hit their head or something. What happens next? What do doctors actually do?
Well, one of the most important tools we have is a CT scan.
A CT scan, that's like taking an x-ray of your brain, right?
Exactly. But CT scans give us way more detail.
So you could actually see what's happening inside the skull.
You got it. We can see bleeding, swelling, even if there's a fracture in the bone. It's really remarkable.
So once you've got that picture from the CT scan, then what? How do you actually treat a brain injury?
It really depends on what we're dealing with. Each injury, each person, it's all a bit different. But the big picture goal,
Yeah.
to protect the brain from any further damage, that often means controlling that intracranial pressure we talked about, making sure the pressure doesn't get too high.
Right, like reducing the swelling and stuff.
Exactly. And we also want to manage pain, make sure the patient is as comfortable as possible, and do everything we can to prevent seizures.
Seizures, right,
Yeah.
because those can cause more damage, I imagine.
Absolutely. Now, for some injuries, especially if they're more severe,
Like a really big bleed.
yeah, in those cases, we might need to go in surgically.
Brain surgery.
It sounds scarier than it is, but
Still scary, though.
for sure. But sometimes it's the best option, to relieve pressure, remove a blood clot, things like that.
So much of this feels like, okay, something's really wrong. We need to fix it now. But what about the long term?
You're hitting on a really important point. Brain injuries, they're not just about the initial trauma.
Right. What about the weeks and months after?
That's when we often see post-concussion syndrome. It can impact people in so many ways.
Post-concussion syndrome, is that like you've just got a headache that won't quit?
It can be headaches, definitely, but it can also be dizziness, fatigue, just this overwhelming sense of being drained. Some folks have trouble with their memory, can't concentrate the way they used to.
So their thinking is foggy.
Exactly. And for some, even their senses are affected. Sounds might seem louder, lights might feel too bright. It can be really debilitating.
And this can last for...
Weeks, months, even years in some cases.
It's amazing to me how even what seems like a minor head injury can have these long-lasting, invisible consequences.
That's why awareness is so important.
So what can people do if someone's facing a long road to recovery? What helps?
Rehabilitation is key. And it's not one size fits all. We're talking physical therapy, speech therapy, even cognitive therapy to help with thinking and memory.
So it's really about retraining the brain.
In a way, yeah. And I think the most important thing is for people to be patient with themselves. Healing takes time.
It always does, doesn't it?
It really does. And when it comes to the brain, well, let's just say it's worth taking the time to heal properly.
Couldn't agree more. This has been a real eye-opener.
I agree.
To think even just bumping your head can have such a big impact.
It really can. So, folks, be careful out there.
Seriously, protect your brains. Listen to your body. And if you're ever unsure, it's always better to err on the side of caution and get checked out.
That's great advice.
Until next time, everyone.